Hello, Dr. Winston Carhee, chiropractor, and I want to share with you how I can help you with your carpal tunnel symptoms. In particular, talk about 3 therapies that are very effective at treating the symptoms that result from carpal tunnel, such as pain in your wrist, radiating to your fingers, also the spasm of the muscles around your wrist, and the joints that may be out of place in your wrist or flattening in your wrist. Now, carpal tunnel will result in weakness of the muscles, tingling, and radiation that shoots to the fingers. Now, we want to make sure that we give you these 3 therapies so that you'll be able to work fuller and be able to, if you're typing, not having the pain in your wrist or your fingers, enabling you to type throughout the day. And if you happen to pick things up, but you can't do it because of the spasm or pain or tingling, these therapies will help you. And it will help you be able to sleep throughout the night without experiencing that tingling feeling that wakes you up, and that will not inhibit you from having a full night's rest. And your activities of daily living might be impeded, such as when you're bathing or showering. Being able to just wash yourself will be impeded if you have carpal tunnel, or if you are actually dressing, if you're combing your hair, or trying to actually put on your clothes. This is something that we can help you with these therapies. Over my 11 years, I found that the main causes of carpal tunnel would be the flattening of the carpal bones in your wrist. That would be impeding on the median nerve that goes to your fingers. If these bones actually are flattened because you're doing too much extension, it will then fall down and entrap the median nerve, placing pressure on this median nerve, which result in tingling. So, over my 3,000 patient visits, I found that there are 3 therapies in particular that help people with this median nerve and carpal tunnel problem. Number 1 would be extremity adjusting of the joints that make up the carpal tunnel, and lifting the bones up and taking the pressure off of that particular nerve. Number 2 would be myocurrent therapy, which helps with the swelling and the pain around the carpal area. Number 3 would be massage therapy, and massage of the muscles, the thenar muscles and the muscles of the hand and along the wrist. Very effective in treating carpal tunnel. Let's talk about extremity adjusting, or talk about chiropractic joint motion therapy. This is when we locate the painful area in the wrist, and we then deliver a light pressure. This pressure would then orient these bones in the proper area to make a nice curve, a dome shape, which will be alleviating the pain over the compression of that nerve. It would then relax the muscles because the joints would then be in the proper position and the muscles would not be spasming any longer. And this helps the joints move freely in the wrist. Number 2, the myocurrent therapy. This is where we place pads over the painful area around the wrist. We conduct a current that will relax the muscles, and it acts as a nerve block, which helps reduce the pain in the wrist and the pain going down to the fingers. This also helps the muscles to relax, and now they're functioning better. Number 3, the massage therapy. This is where we take the tightened, short connective tissue in the wrist and the muscles, and we manually stretch the tendons and the muscles in the wrist, would allow the muscles to relax and allow the joints of the wrist and the hand to move freer and decrease pain. Now, many patients have great results with these 3 therapies. One in particular is Joan, who was suffering from carpal tunnel that was interfering with her ability to type and work, and also her ability to have a great night's sleep because she had woke up with tingling down the wrist. When after Joan's first therapy treatment, Joan felt 50% better. And in 10 days, Joan felt 75% better. Now, this was great for Joan, and many patients have similar results. But let me share with you why patients say they choose our offices for care. We are centrally located, 1 mile outside of 285 on Cascade Road in beautiful southwest Atlanta. And I'm on the board of the Georgia Chiropractic Association, which protects and promotes the patient's right to choose their healthcare provider. Number 3, I'm the president of the National Black Chiropractic Association, which promotes chiropractic care in underserved communities. What I would like to do for you is offer you a chance to experience chiropractic care by giving you a $47 new patient special. Now this is 75% off of my normal rates. Now the reason I'm giving you the special is to make it easy for you to see if chiropractic care is right for you. This will be a 6-part new patient examination. I will sit down with you in a consultation and find out exactly what's causing your carpal tunnel injury. Find out which anatomy parts might be involved in your carpal tunnel and your radiating pain. This is so I can choose the correct therapy to get you out of pain the fastest. Number 2, we'll do a range of motion test to see if there's any restrictions in your joints. Number 3, we'll do specific muscle testing to figure out which muscles in your hand or your wrist might be weak. Number 4, we'll do specific nerve tests to figure out if the median nerve is actually the cause of your pain. Number 5, we'll do specific risk orthopedic tests to figure out if this is truly carpal tunnel and figure out which cartilage, what ligaments, what tendons might be involved. Again, this is so we can find out the exact anatomy involved in your pain and figure out which therapies might be getting you out of pain the fastest. There will also be a bonus free massage session where we'll deliver a massage therapy to help the spasm muscles and the painful muscle areas to give you relief on your first visit. There's a 2-part guarantee. If during your examination we find out that chiropractic care is not right for you, we will refer you to the proper specialist. Number 2, if you're not 100% satisfied with your examination on your first visit, there'll be no charge. And you still get to keep your free massage session. Now this is limited to the first 10 callers of any calendar month. So if you are suffering or in pain, be one of those first 10 callers. Call me at 404-699-0966.